hospital at Kitakauchi, and we're trying to locate the doctor so we can talk to him about some future help from the United States. But there's one doctor here, and we can't seem to locate him, and so hopefully we'll be able to locate him here. None of the nurses or anybody knows where he's at, but he has a huge area to do all by himself, so he can't be in 10 places at the same time. Can you just give us a tour of the rooms? And I know that there's a little girl or boy in here that needs surgery.
Yeah, the child this is our
treatment
room.
Okay. This is a treatment room?
Yeah, this is where we give the medications.
Okay.
All the injections.
So all your medication for the whole children's ward is in this room? Okay.
So we keep them here.
Okay.
The trolley is not big enough. It's the bigger one, and then the one that can move. This one is still movable, it cannot move. Very old and rusted. So we need a bigger one.
Okay. So you want something that you can move from room to room?
Yeah, from room to
okay.
room. So this is our service room.
Dr. Doe's here?
Wow.
The power just go out?
Yeah, I got it.
Ay.
So,
Okay.
I'm going.
Okay.
Oh, yeah, living like that.
Yeah.
Okay.
And the same place where we keep our bed sheets.
Okay.
The bed sheets.
So is this all you have?
Yeah, this is all we have. Not enough.
Okay.
And the bed pans also.
All right.
So the bed cradle and other things, we don't have them. They are all spot.
Okay.
The machine to be washing there.
Yeah.
The bed pans, so we don't have them.
And I'm sure that it makes it even harder when the power goes out and then we're in the pitch black.
Yeah. So this is the ward. Very small. No, they are twins.
Okay.
This one was on admission by discharge. For
Okay.
severe malaria.
Malaria. All right.
Discharge, but they are twins, so they are still in there.
Okay.
We have 16 bed capacity.
16 bed capacity.
16, but sometimes we get about 41 children. So most of them sleep on the floor.
41 children?
Yeah.
So sometimes there's 41 children in here at the same
here,
time
and they all sleep on the floor.
on the floor.
Yeah.
Wow. And what about this little girl? She's
Yeah, also a case of severe malaria.
okay. So
Actually, it's a malaria endemic area, so most of them malaria and then enteric fever, typhoid.
typhoid and malaria. She has
Yeah.
both.
Yeah.
Oh my goodness. Okay, thank you. Thank you. Okay.
She needs an emergency laparotomy.
Okay.
So for right now, we don't. There is no one available right now. So what we are doing is to refer to the nearest.
The nearest hospital, which is about 5 hours away,
5 hours
if you
away.
catch the ferry.
Yeah, exactly.
So really, it's more like a 10 to 12.
Kind of.
Yeah.
Kind of.
10 to 12 hours.
Yeah, 10 to 12 hours. And one thing that we lack here, is, if you can see, is patient monitors. So, and most of them are also hypertensive, and we don't have patient monitors to pick any kind of emergency. And also, there is no ECG monitor as well.
Okay.
Yeah, that's one thing that we lack over here.
Okay.
She has a very acute abdomen, so she is being prepared to go for treatment, surgical
Okay.
treatment for laparotomy to
And-
find out what exactly it is.
So she'll travel about what, 10 hours?
Yeah. She'll be referred
How long
to-
has she been here?
She's been here for about 3 days.
3 days.
Yeah, she'll be here
And is she on pain medication? You
for,
guys have pain
she's
medication?
on pain medication and antibiotics and fluids as well.
Okay.
Yeah.
Okay. Tell her I said thank you, and I hope she feels better.
That's all that was.
So if somebody has an emergency, there's nobody here that can do any kind of an emergency surgery.
Yeah, if the senior doctor is around, who's a surgeon, then he is in the
Which is Dr.
Dr. Hilarious.
Okay.
Yeah.
Which he's out of town right now.
Yeah, right.
So these are women that are pregnant?
Yeah, they're
They are pregnant, but
Okay.
they are not in labor. So when they come in first stage, when they are the pregnancy is attended, not fully dilated, they stay here. When they are fully dilated, we send them to the labor ward.
Okay. So you have 4. So is this adequate? Like there's 6 beds. Is it?
The room is not big.
It's not big.
So only 6 beds. We can accommodate 6 beds. Sometimes they come plenty. Some sleep on the floor.
Okay.
On the floor, on the veranda.
Okay.
Yeah.
What do you give them for pain when they're in labor?
Sometimes it reaches somewhere you have to endure the pains. When the cervix is dilated, we encourage them to be doing breathing exercise.
Okay.
But someone will say that I'm in labor. Meanwhile, the cervix has not dilated or
Okay.
increased. So we can just give just paracetamol for the pain. But if the cervix is dilated, fully dilated, because the pain comes with the contraction and this, we encourage you to be doing breathing exercise.
Okay.
And
So to get through their pain, they really need to do the exercise. There's no epidurals. There's no epidurals here.
We
Yeah.
don't give.
Yeah.
We either we massage the back.
Okay.
If you something support, it will go so that.
Okay.
Yeah.
Okay. Okay. Well, thank you so
Thank
much.
you. You are
Thank you for
welcome.
talking to
Yeah,
us. Thank you.
Thank you.